So today we'll be talking about a chronic illness called leukemia, and it's the cancer of white blood cells within the body. So leukemia can be categorized under two categories, chronic and acute. So first off, with acute, it usually affects children, and it's more quick. It happens much faster, and it's more harsh. And usually, the life expectancy of a person with acute leukemia is very short compared to the one with chronic. So with chronic leukemia, it's more gradual. It happens at a longer time, and it's usually seen at a higher age group. So people who are around 60 years old to 70 years old and up. You usually don't see people under the age of 40 having chronic leukemia, and vice versa. You don't see people that are older having acute leukemia. So, a little bit of the etiology of leukemia. There's a few predisposing factors. So there's like people who take anti-tumor drugs will get leukemia. People who go through radiation might get leukemia, and there's also congenital predispositions. So maybe off a secondary cancer, you can get leukemia. From harsh chemotherapy, you can get leukemia. If a person has Down syndrome, and also genetics could be a factor. So a little bit of a manifestation information. A person with leukemia could be fatigued. They could always be tired. They could have like constant infections, fevers, bruising, bleeding, swollen lymph nodes, and headaches. They could also have headaches. So one could ask, how do you treat leukemia? So like a series of therapies. So like chemotherapy, which is when a doctor gives a person drugs to fight the cancer. Radiation therapy, where they go through radiation to kill the cancer, and also through surgery. So like bone marrow transplants and stem cell transplants, they could help fight leukemia. Some indications of massage therapy for leukemia. Usually when a person is indicated for massage therapy, they're usually fatigued, tired because they are anemic. They have low red blood counts, and usually they're kind of depressed and they're kind of sad. So when someone goes for massage therapy, a patient who has leukemia, um, they're usually there to become more physically stimulated. So like they want to increase the blood flow in their bodies. So maybe after the treatment, they could be more upbeat. They could have like an uplifting feeling, and also to have like relaxation throughout the day after the massage therapy treatment, because a person with leukemia has a harsh time doing their chores and stuff. So maybe this is like a good time for them to relax, sit down, and have like a good massage. A few contraindications of massage therapy is that if there's any like tumorous malignant lumps within the body, you want to totally completely avoid that. Deep vein thrombosis. If a patient with leukemia has deep vein thrombosis, you're going to want to avoid that completely. Also, you want to avoid any deep pressure towards the joints and any bones that are like aching or stiff or sore. Some precautions. A person with leukemia tends to be bruising for no reason. So if the bruising does hurt, you want to ask the patient if it's hurting at all. So you want to avoid it if it does. Also, patients with leukemia tend to have fevers. So if they do come to clinic with a fever, you want to ask them if it's still okay to treat, if they're okay getting on the table, if they don't feel too sick, and also maybe keep like a bucket in case they want to hurl if they're not feeling too well. And you also want to avoid like positions that would be uncomfortable for the patient. So like positions like being prone, you want to avoid that, especially if they have malignant lumps on the anterior side. You don't want to be making them lie down prone. You kind of want them to be at a position where it's semi-recline, position where they can be comfortable, or even supine with like a few pillows under their legs and maybe behind their head. And finally, modifications of treatment. A person with leukemia, you're gonna want to treat them with more care. So basically, give them like a generalized wellness massage with less pressure, because you don't want to be um, stimulating any kind of pain or any kind of discomfort. So lighter techniques and more general massage to maybe increase their immune function overall, and just give them a more uh, better mental and physical like presence or better feel. So that's it for the information I have on leukemia, and I hope that is sufficient.